What is Medicare and why is it important for a dialysis patient to be on Medicare? Find out next. Hi everybody, my name is Kyle Chang. I've been a dialysis patient since 2013. Most hemodialysis as well as peritoneal dialysis. What I want to talk about today is Medicare, which one you should have, and what are the difference between Medicare Traditional and Medicare Advantage. So as a dialysis patient, we are one of the few folks under 65, regardless of age, that can obtain Medicare. Otherwise, normally Medicare is only available for seniors over age of 65. Dialysis can be very expensive, both from the treatment as well as the transplant if you're going for a transplant. Most insurance companies that are for-profit, that are private insurance, they do not want to pay for those. So there was a legislation passed back in the 70s under the Nixon administration that allows dialysis patients to partake in Medicare Traditional. If you are a senior and you have Medicare Advantage, prior to being diagnosed with dialysis, you fully are able to keep that Medicare Advantage plan. Big advantage of having a Medicare Advantage plan is the costs are typically lower, the premiums are a little bit lower overall. It also covers vision and dental, which a lot of people like. However, as dialysis patients, we typically are not able to take part in Medicare Advantage if we're under age 65 or if we've already been diagnosed with ESRD and been on dialysis. Because private insurance companies, their goal is to maximize their profits, collect premiums, and pay out as little claim as possible as a business practice. So therefore, Medicare Traditional is available for dialysis patients. That's a great advantage to us in many ways. Medicare Traditional works more like a PVO, so you do not need prior authorization from other doctors or a primary unless you need a referral as to which doctor you need to go to. You can select any doctor you want throughout most of the country, and most hospital systems that receive federal funding in some way, they are required to take Medicare patients. There are some doctors or dentists or chiropractor that's in private practice. They may have the option of not taking participants in Medicare. So just check on that on their website and check when you schedule the appointment, make sure that they do take Medicare. Otherwise, it works pretty much like a PPO where you don't need prior authorization. The disadvantage with Medicare Traditional is it only pays 80% of the approved services. If you are a Medicare participant and you don't have some other insurance that works as a supplement, then you are personally liable for the other 20%. As a dialysis patient, on the bundle cost of dialysis, it's typically $5,000 to $6,000 per patient per month, and it's charged per treatment. And I'll talk more in the other video in regards to what that bundle cost consists of. There are a lot of things, it's not just the treatment itself. So, and that's for any modality. It's one-time reimbursement per treatment per patient, and it's the same all across regardless of which modality you're on in the CMS payment schedules. So without the supplement plan, you are personally liable for the 20%. Medicare pays 80%, which is excellent. It's already most of it. However, the costs do add up as a dialysis patient, not just for the dialysis services, but also other associated things that may be expensive. You may be required to see specialists such as cardiology or oncology or infectious disease. And those typically are service visits that cost a little bit more. They might charge a little bit more for some of the tests, especially cardiology. If you have to go through all those, I know for me over the years, I've done multiple CT scans, I've done x-rays, I've done MRIs. None of those things are cheap. So if I had to pay for those all on my own, it would add up very quickly and very expensively, especially the first year when I was trying to be listed for transplant, where all those tests are required. Some of the options for supplement that are available are Medicaid if you meet the low income criteria in your state, and in some states it might be a little bit different. For example, in California they're called Medi-Cal, but it's really the Medicaid system, and that is for low income individuals that qualify. You could talk to your social worker about whether or not you meet the qualifications for that state, or even try applying for it if you're not sure. There are other things that could be used as supplement. You could purchase your own insurance. as a supplemental policy, and that would pay for the other 20%. However, supplemental plans are not always available for those with disabilities like us on kidney failure when you're under the age of 65 in all states. So you want to check with that as well. Supplemental plans are private insured, and if you could purchase Plan F, that premium is a little bit higher. However, it pays for 100% of the bill charges and approved charges after Medicare pays for it if Medicare is your primary. Plan F, 100% coverage. Plan G and H, if you could get those in your state for under age 65, those are low premiums with a small copay and deductible currently. So look into the details of those plans in your state. Sometimes the premiums are a little bit more affordable for certain folks that cannot qualify for Medicaid in your state. Those are my 3 recommendations in terms of supplemental plans that are available, whether you're a senior or somebody on disability. The only issue is if you're under age 65, not all those supplemental plans are available for you in your state. So you might have to look for some other plans besides F, G, and H. However, a lot of states that do have Medicaid participants or disability coverage for supplemental programs under age 65, those plans are often available. If you're over 65, all those plans are available. Supplemental plans A through whatever GH now, all those are available. You can look at the information at Medicare.gov and compare insurance pricing. So those are supplemental plans that are available to pay for that other 20% that Medicare does not pay for, and then you should be pretty set besides the premium costs. A third option for secondary plan is if you are working. If you're working, you are available to use your work insurance as a supplemental or gap plan to pay that 20% coverage that Medicare does not pay for as well. Sometimes your work plans may also include prescriptions, Part D prescriptions, or dental, vision insurance, and long-term care health as part of that package. So if you are working and able to partake in those insurance programs, that is excellent. The next thing I want to talk about is Medicare Traditional. So Medicare Traditional has Part A and Part B. Part A covers all of your in-hospital charges. So anytime you've been admitted to the hospital, anytime you're in the ER, emergency room, for treatments, all the labs and different things that are part of that hospital system are covered under Part A. Some of your doctor's bills that you see while you're in the hospital may be a part of Medicare Part B, and the Part B typically covers out-of-hospital charges and outpatient services, which dialysis services are included under Part B. So know the difference between the two. And this is important on the next topic I talk about later, is that if you already have some other private insurance or work insurance before you were diagnosed with ESRD and also being a dialysis patient, that insurance takes precedence. They serve as the primary insurance for the first 30 months of your dialysis treatments and first 30 months of transplant, depending on when you started Medicare coverage. And that's based on your dialysis start date. So the first 30 months, if you have other insurance, that takes primary. And then when you sign up and get approved for Medicare Tradition, Part A and Part B, that becomes secondary. So that means your primary insurance pays first, and then your secondary insurance pays next. Starting the 31st month of dialysis treatment, your Medicare becomes primary, and they do a flip-flop. Okay, so then your other private insurance or your work insurance now becomes secondary, and they pay that 20% instead of the 80%. So make sure all those things are covered and you are aware of these changes. A lot of people get caught surprised around that 31st month and after with a large bill from their dialysis center because they did not prepare for those. 31st months from the start date of your dialysis. This is called the coordination of benefits period for Medicare. And it happens regardless of whether you have Medicare established or whether you've been approved or not. So if you are delaying Medicare until a little bit later because it's more expensive with the premiums that you have to pay out, you want to make sure you start doing that around month 26, 27, get all those approved, because sometimes it takes about 4 to 5 months for Medicare to be approved and then kicked in and be activated for those bills. Make sure that you get that taken care of, because when that switch happens, your private insurance, work insurance, sometimes can start denying billing and paying those premiums, and then you are responsible for those charges. And it's pretty large bills and significant bills that folks get caught up surprised at. So make a note on your calendar close to that 31st month period from the dialysis start date. Now, some states with supplemental policies, you have 6 months from the start of when you're eligible for Medicare, not when you get approved, when you're eligible to get Medicare, which means your dialysis start date, right? So if you don't purchase a supplemental plan, and let's say you don't have work insurance or private insurance that's available to be a supplemental, if you don't apply for that within the first 6 months of your dialysis start date, you may no longer be able to be eligible to pay or pick up a supplemental plan at that point, past the 6 months. So that's something you want to be aware of as well as a new dialysis patient, just to work with your social worker, try to get those things in place before. Otherwise, later on, when you pass the 7th, 8th, 10th month, and you need that supplemental plan, you may not be able to purchase one. That's good to know that ahead of time, and be aware of it. A lot of planning. I know there's a lot to keep up with besides your disease as a new patient trying to get accustomed to it, but hopefully all these tips help you and get you a better understanding of how Medicare works for a dialysis patient. If you have any other questions, do comment below. If this video was helpful, give me a thumbs like. And if it's the first time that you join me at kidneyjourneys.com, go ahead and click on the subscribe button above. That way you would be notified of new videos and new content that comes out later. Thanks for joining me at kidneyjourneys.com. Again, my name is Kyle Chang.